Hello, this is Dr. Jim Collins, and I have a series of very important videos for you that I've put together. This one is reducing stress through training and education. And as a gerontologist, I'm talking to healthcare professionals, those of you out in senior care in particular, because elderly people are so vulnerable at this time. So I went into research mode rather quickly. So healthcare professionals must focus on their well-being, their residents, patients, and clients, and they must remain emotionally resilient throughout the COVID-19 emergency. The better prepared you are, the easier it will be to maintain essential healthcare services that we require so much out there now. Stress is a normal part of any crisis. Don't feel bad if you're stressed out or anxious. You're feeling bummed out or helpless right now, because a lot of folks are. But it is important to put certain supports in place in preparation for your healthcare team. So training and education is the point of this video. Healthcare workers and licensed professionals are very familiar with annual and ongoing training and education, either in person or online. Healthcare organizations might find it very beneficial right now to deliver more information to their team today and on an ongoing basis to best prepare for a number of scenarios and situations that may arise. Training and education could do something else. It might reduce anxiety and fear that healthcare workers have about COVID-19. So if you're going to do education and training, here are some pointers. Number one, be specific. Training and education should be very detailed concerning the transmission of the COVID virus. Healthcare workers should know how to screen patients, residents, or clients, as well as maybe even their family members. They should also receive more training on the proper use of protective equipment, personal protective equipment, because you're probably going to go through a higher volume of PPE. They also need to know about self-quarantine, self-isolation, and the differences between the two. I have a video that addresses that specifically. Discussions with employees should also involve ethical choices they may have to take and make in the upcoming days and weeks. Another pointer, increase self-efficacy. Education is one thing, but actively having employees engaged in training through role play, practice, and demonstration can greatly improve their confidence and their self-efficacy. Employees can practice response to certain situations, like implementing various levels of quarantine. They can perform drills such as enforcing movement restrictions, working with limited resources if it comes to that, and unfortunately handling casualties if there are any. Another pointer, be prepared. They can also openly talk about and honestly talk about their stress levels and ways to better cope through this emergency. They can share ideas about daily high stress demands and focus on mental and emotional health. They should have plans in place if several employees need to self-quarantine and stay home, and they have a reduced workforce. You might want to prepare for that if it comes to it. Other training topics would include caring for frontline stress, work and rest schedules, and support for employees and their family members. So COVID-19 brings with it many risks to large numbers of people across the country. It also brings more than just the physical risk. It brings fear and anxiety that can be greatly reduced through training, education, and ultimately being more prepared. The more prepared we are, the less stress we will have, and we will know how to act and engage. Healthcare communities should quickly gather information from reliable sources and arm their staff with information they now need to know and understand. I'm Dr. Jim Collins. Stay tuned. I am going to keep providing more and more information on preparing for the COVID virus outbreak. Take care of yourself.